Hi everyone, Nicole here again. Today I want to talk to you about clinicals, the practicum experience in the NP program. Many of you have questions regarding what to expect out of nurse practitioner clinicals, and it's important that you start thinking about this early on in the program. It became very clear to me as I navigated through trying to find a preceptor for each area that I needed to, that I should have started a lot sooner. For me, I went through the family nurse practitioner program, which is divided into 4 separate practicum terms, 2 which are internal medicine at the beginning and end, and then pediatrics and OBGYN in the middle. Securing preceptors can be tricky, particularly if you have not worked or networked in that area in your community before, but all hope is not lost. There are lots of things that you can do to try to secure your preceptor. So we'll talk about that. One of the things that you can do, and it's probably the first thing you should do, is look to people that you've worked with in the past. Health systems, doctors' offices, friends you may know. This is the time to call in any and every favor from people that you've worked with. Maybe you've worked with someone that's graduated and is working as a nurse practitioner or a PA. Physicians are also welcome, but for my program, you did have to have 2 nurse practitioners during the course of clinicals. One of the other things that you can do, which I did many of, is making cold calls, as they would call it, phone calls to the practices and asking to speak with the practice manager or directly to the provider that you are wishing to be precepted by. Sometimes this is leaving messages, sometimes multiple messages, although I caution you to at least allow 1 to 2 weeks in between calls, and hoping that they call you back. Sometimes they do not call back, and sometimes they do, just to let you know that they're already full. Securing a preceptor does require maybe taking a year to a year and a half in advance, looking at the terms that you're going to need them, and having all of that information ready when you call. Many times they will want to see a resume or a CV, and you can also do this by sending a letter to the practice. Within the letter, you want to include your CV or resume, the specialty area that you are looking for a preceptor in, as well as the term with the dates, the school that you attend, and any other information that might make you look attractive to them as a student. That is honor society information, extracurricular activities and awards, definitely things that you've been involved in within a community, and try to withhold any personal information. This is often just not something that needs to be included, and it may actually hurt you as a student if you include too much personal information. You want to be very concise and to the point, and thank them for their time. And I would definitely recommend putting a deadline for them to respond. So if you are looking for a preceptor and you are a year to a year and a half out, it's perfectly within reason to put a deadline of 1 to 2 months out from the time of the letter, so that you can mark them off your list, or you can secure them as your preceptor. Those are the different ways that you may find a preceptor, although I've heard many people needing to pay an agency to find a preceptor for them. I would use this as a last resort. They could be very expensive, and it's just not necessary unless you have exhausted all other possibilities of obtaining a preceptor. Many of the universities often will work with you, even if they don't secure one for you. They often will have a list available for previous preceptors they've used in the past, and their contact information. So I would check that out as well. One of the other issues that I've heard is people are actually paying their preceptor for their time. This is not mandatory. This is done on a case-by-case basis, and if this is something that you cannot afford or it makes you feel uncomfortable, then keep looking. Sometimes, as a last resort, you need to do so. One of the other things that I wanted to mention is one of the trends that the hospital systems have been moving toward because of the amount of students that are requesting preceptors is the fact that they are only taking employees from their organization and allowing them to have preceptors within the health system. While this is frustrating for many, there are ways around it. If you are not an employee of the health system that you are desiring a preceptor, you can often do volunteer hours or even attempt to obtain a per diem or PRN position that will allow you to be an employee of the system without putting in full-time or part-time hours. This will then allow you the ability to gain a preceptor within that health system. It's just an idea. It does help many. But sometimes you do need to continue to look outside of a major health system because of this reason. The other thing that you will need for practicum is you definitely need to obtain a lab coat, a stethoscope. You're going to need the pack of tuning forks. It's helpful to have a portable pulse ox, and also you want to make sure that you have proper attire. When you're going to clinicals, it's not necessary for you to wear scrubs, but rather business casual, and you definitely want to wear comfortable shoes. Those clinicals, you can be on your feet for long hours, and you want to be comfortable when you're doing that. One of the other things that you want to take into consideration when you are thinking about choosing a preceptor is their experience. How long have they been a nurse practitioner or PA for? How long have they been a physician? Have they had enough years of experience to offer you not only mentoring ability, but do they have a vast body of knowledge to teach you, from? Because although many new grads are asked to be preceptors, it's very difficult as a new grad when you're trying to find your way to take on a student who's trying to do the same thing. So it is acceptable to ask your preceptors what their level of experience is, how long they've worked for the company, the type of patient population that they see, how many patients per day, because you do have to meet a quota. Often nurse practitioner students are seeing upwards of 600 hours and equally that many patients per term. And this has to be identified and documented. So if you are going to a small community-based clinic that only sees 4 to 5 patients per day, this is likely not going to allow you to pass that class. So that's something for you to think about as well. One of the other things to consider when you are thinking about clinical is developing your differentials. Now, most people, they take a review course, such as the Hollier videos, the APEA review, the LEAK review. There's many reviews out there. They're all equally very informative. But students wait until they're getting ready to take boards to do that. If I have any piece of advice to offer, it would be this. In addition to preparing for clinical with getting your lab coat and the instruments that you need and procuring your preceptors, please consider doing a review. When you do these reviews, what you are doing is preparing yourself to see those patients as a student. This is your time to practice. This is your time to go in with the preceptor. They're going to introduce you. You will likely be left to see the patient on your own. They're going to come back, sometimes even in front of the patient, sometimes not, but they're going to ask you, what is wrong with this patient? What do you want to do for them? What tests do you want to order? What medications do you want to prescribe? So, my advice is to do the review. do the review prior to clinical. When you get to clinical, you are going to be able to see that patient, do an incredible assessment, develop a list of differentials, and you're going to be able to discuss this with your preceptor in a systematic manner, and you are going to really get the most out of your clinical experience. So that's all I have for now. That is some of the things that have come up for me as a student, and I just wanted to pass it along. And if you have any questions or comments, please feel free to leave them. I will try to give you a sense of what has happened along my journey, and I hope that I can help you with yours. Take care.